In this film, the application of an ulnar gutter splint is demonstrated. In this case, the patient is presenting with a non-dislocated Boxer's fracture, a fracture of the base of the fifth metacarpal bone. If the fifth or fourth metacarpal bones are affected, the third to fifth rays should be included in the splint. In case the third metacarpal bone is affected, the second to fifth rays should be included. Before applying the splint, the digit is examined for rotational deviations. When making a fist, all digits point towards the scaphoid, which is clinically normal. If the affected digit is rotated towards the radial side, or ulnar side, reduction should be performed or even surgery if reduction is not sufficient. The sensation in the hand and digits is tested, as is the capillary refill. The wrist and elbow are also tested for functional impairment and pain. All these examinations are used to detect abnormalities so they can be acted on if necessary. Also, the results can be compared to the physical examination after the splint has been applied. The following materials are needed to apply an ulnar gutter splint: 2 small stockinets with a width of 2.5 centimeters each, a stockinet with a width of 5 centimeters, padding with a width of 7.5 centimeters, plaster. For an average-sized adult, 8 to 10 layers of plaster should be sufficient, an elastic wrap with a width of 7.5 centimeters, and bandage scissors. All sizes of materials depend on the patient's specific characteristics. First, 2 small stockinets are applied around 2 digits, one around the 4th digit to avoid irritation between the digits, and one is applied around the thumb. The length of the stockinet which will be applied around the forearm is measured. The stockinet should cover the entire forearm and should be long enough to cover all digits. 2 holes are cut in the stockinet, approximately 2.5 centimeters apart, through which the thumb and the second digit can be placed. The stockinet is rolled up and slowly applied around the forearm, at which the second digit and the thumb are placed through the 2 holes. Note that the stockinet is wrinkle-free, as wrinkling may cause irritation of the skin. Also note that the entire forearm and digits are included in the stockinet. After applying the stockinet, the wrist and digits are placed in the correct position. This means that the wrist is placed in 20 to 30 degrees of extension, and the metacarpophalangeal joints of the second to fifth digits are placed in 70 to 90 degrees of flexion, as shown here. This is called the intrinsic plus position and is important to prevent excessive stiffness after the splint is removed. Next, the padding needs to be applied. Care should be taken to apply extra padding over the ulnar prominence to avoid pressure complications. Too much padding should be avoided, as this may cause the splint to be too loose and be able to move over the arm, which may lead to pressure complications, scratches, or blisters. The padding is applied so that the flat part is in contact with the limb, allowing easy unrolling. The application is started over the wrist, making sure to include the ulnar prominence. Then twice distally around the digits to be included, through the first web space, again over the wrist, and again through the first web space. The padding is unrolled further proximally until the entire forearm is covered. Note that each turn of padding overlaps the previous one by 50%. After applying the padding, the stockinet is still exposed distally and proximally. This way, it can be folded back, as shown here, to protect the skin from sharp edges after the splint is applied. It is advised to check if there are no uncovered areas left, as this should be avoided. The required amount of plaster is measured by using a piece of padding. The plaster should be applied 2 finger breadths from the elbow crease, along the ulnar side of the arm and hand, slightly beyond the distal interphalangeal joints. The padding is placed onto the plaster to make sure both are of the same length. Next, how the plaster will be applied while dry is demonstrated. Note that the removed triangle is located around the 5th digit, so the distal phalanx remains exposed. Water at room temperature is used as too hot water causes the plaster to harden too quickly. The plaster is folded in a corrugated fashion. Care should be taken not to hold the plaster in the water for too long. The plaster is squeezed to get rid of excess water. It is applied to the arm and smoothened so any wrinkles are removed and the water is distributed evenly throughout the plaster. Care is taken to not place the plaster over the skin, as this will irritate the skin and may cause thermal injuries. The remaining stockinette and padding is folded back to create smooth edges. Note that the distal phalanges of the digits are well exposed. Also note the folded back stockinette of the thumb. An elastic wrap is applied to fixate the splint. Again note that the wrap is applied so that the flat part is in contact with the limb, allowing easy unrolling. It is applied in the same way as the padding. The wrap is cut so it fits around the thumb. In this way, wrinkling of the wrap is avoided. Note that some traction is placed onto the elastic wrap during the application. Too much tension should be avoided, as this may compromise blood flow to the digits. It is unrolled further proximally until the entire forearm is covered. The plaster is molded in the intrinsic plus position. Care is taken to avoid molding the plaster using fingertips, as pressure points may arise. One hand is placed on the dorsal side supporting the fracture. The other hand is placed on the volar side, with the thumb in the palm of the hand and the other fingers proximal from the fracture. This creates a 1, 2, 3-point fixation, which is needed to adequately support the fracture. The plaster is supported in this position until it is hard enough. Note that the distal phalanges of the 3 digits included in the splint are still exposed and are in line with each other. Note that the distance from the splint to the elbow crease is about 2 finger breadths. This is needed to adequately flex the elbow joint when placing the arm in a triangular bandage. The capillary refill should again be examined after the splint application is completed. A triangular bandage is used to immobilize the arm. The longest side is positioned over the shoulder of the unaffected arm. The other side is positioned over the shoulder of the affected arm. A reef knot is used to fixate the triangular bandage. A safety pin is used to attach the triangular bandage to itself, making sure to support the elbow. This finishes the application of the triangular bandage. Note that the hand is positioned higher than the elbow to prevent swelling of the forearm and hand. It is advised not to use a sling because a sling may cause impressions in the plaster which may cause pressure complications on the skin.